Since the Supreme Court overturned Roe versus Wade,
folks in the healthcare ecosystem, including the patients, were very concerned about reproductive data.
We've heard from patients, providers, major medical organizations, and organizations representing thousands of individuals nationwide. They are concerned about their medical information being used to target and track what healthcare they receive.
Providers had to practice with fear and trembling because the providers could be investigated, the providers could be disciplined as well. So in response to that, the Department of Health and Human Services and Civil Rights came out with this
final rule to update that standard with the HIPAA privacy rule to support reproductive health care privacy.
And as a result of this final rule, across the nation, organizations prepared themselves for this to the cost of almost $600 million. Why? Because of the public outcry demanding a special protective class for reproductive data.
This update prohibits HIPAA-covered healthcare providers, health plans, clearinghouses, and their business associates,
folks reaching out to the government and saying, we need this to change because I don't feel safe.
Using or disclosing an individual's protected health information to conduct
investigations into or to impose criminal, civil, or administrative liability on
any person seeking, obtaining, providing, or facilitating lawful reproductive health care.
It strengthens privacy protections and prevents the disclosure of
this information to third parties, and there are conditions that are required to be met before it can be disclosed.
So let's pause there. Organizations were getting ready to comply with this final rule announced last year. A lot has happened since then. April 18th, 2025. A federal judge in Texas decided to vacate this final rule
nationwide.
One of the major reasons given was the difficulty providers, organizations, and entities would have in complying with this final rule. Sequestering reproductive health data was too difficult. And so, despite the entities, the providers, voting citizens that said, I want reproductive data to be private and I do not want it used punitively, this nationwide vacation
permits the use and disclosure of your reproductive health care information,
even though a lot of the work already started to the tune of hundreds of millions of dollars. All of a sudden, that potential for go-to-market became narrower and narrower and narrower. So this is what we're actually going to end up doing. Instead of running away, Trimesters is going to share Ester as planned with folks that's where we want to be. Trimesters is partnering with providers, organizations, and entities committed to maintaining privacy protections around your maternal health, your reproductive health data.
No one should live in fear that their conversations with their doctors or that their medical claims data could be used against them.
We are going to double down and we are going to move forward, ensuring that the public outcry is translated into protections for reproductive data. We are going to build a network of trusted providers. If that is you, reach out to us. We would love to talk about how we can work together
to help protect reproductive health care
that patients truly deserve.
Look out for new updates.